Hey everyone, it's Raj from 3CB Performance. Today's topic is Barcelona center back Samuel Umtiti, who missed the majority of the 2018-2019 season due to ongoing pain and irritation in his left knee, managing it via conservative means. The injury hasn't only limited his play, but it strained his relationship and future with the club, as Umtiti has gone from untouchable rising star to being declared an unneeded piece by Barcelona. Understand how we got to this point and what may be going on with Umtiti's knee, let's go through the series of events starting back in May of 2018 when he first began to experience overt irritation in the left knee. During that period, he missed roughly 3 weeks in the final 3 games of the Barca season. However, he returned May 28th for international friendlies and then played in 6 games in the World Cup for title-winning France, including scoring the game-winning and only goal against Belgium in the semifinals. Umtiti himself has admitted that playing in the World Cup made his knee much worse and that he didn't take the necessary precautions because he was so set on playing. He played through constant pain and ignored the medical recommendations of the Barcelona medical staff, who had advised immediate surgery with an estimated recovery time of 5 months to alleviate the knee trouble rather than allow it to linger and possibly worsen. And worsen it did. In late September 2018, Samuel had severe discomfort in the left knee that forced him to miss 43 days and 9 games. During this period, he underwent physical therapy to strengthen the muscles surrounding the knee and lower body in order to lessen the amount of force and stress through the knee joint. However, he was only able to play 1 game against Atletico Madrid before knee irritation and pain sent him back to the injury list. With physical therapy alone failing, Umtiti was sent to Doha for a more aggressive approach. Platelet-rich plasma, or PRP, injection therapy followed by physical therapy. The PRP process operated by removing blood from Umtiti, running it through a centrifuge to separate the different components, concentrating one of those components known as plasma, and then re-injecting it back into his knee joint. The hope was that the plasma would restart the healing process in the knee and change a negative healing environment into a neutral one. Once you're out in front of the problem, there's a much larger window for physical therapy to reinforce the change. The process took nearly 3 months for Umtiti, which isn't out of the ordinary in these types of PRP procedures, as you're often not cleared for activity for up to 8 weeks after the injection, and he returned in late February, playing in 7 matches for Barca and 2 international friendlies over the final 2.5 months of the season. The question in all this is, what exactly is going on with that left knee? The medical team has been very tight-lipped with information, and all I've found are consistent rumblings of loose cartilage and a potential return timeline of 5 months after surgery. I have some inclinations, but based on Barca immediately calling for surgery, I reached out to an orthopedic surgeon familiar with this type of case to give a more informed and detailed opinion. Based on what he told me, here's what I gathered. This sounds like what's known as a quote-unquote osteochondral defect, which involves focal damage to a piece of articular cartilage, a force-absorbing, friction-reducing tissue that sits on the end of long bones like the tibia, shin bone, and femur, thigh bone, and the underlying bone, quote-unquote osteo. These defects nearly exclusively take place on the femoral articular surface, and the cartilage can actually break off into the joint and cause irritation and pain, which would explain the loose cartilage terminology. These are often referred to as quote-unquote loose bodies within the joint. Further, broken off cartilage exposes the damaged bone, which leads to more pain and irritation. If there's multiple cracks in the cartilage and bone, it's typically known as quote-unquote osteochondritis dissecans, which results from a lack of blood flow to the underlying bone and causes cartilage and bone to chip off in the joint. It typically occurs in young athletes involved in a lot of activity and most commonly affects the knee joint. That profile lines up with Umtiti. Depending on severity, or in this case the strong preference of the player, treatment can start conservatively with less invasive options like physical therapy and PRP, but it can be difficult to alleviate the irritation and pain without addressing the underlying issues, the loose bodies, and damaged bone, which require surgery. That's probably why Barca recommended it in the first place. Depending on the extent of the injury, there's multiple surgical options available, which usually means none of them are that great, as is the case here, but the underlying theme is the same. Remove the loose cartilage and or bone fragments from the joint, and then attempt to restore the exposed bone with new cartilage. That restoration can be done via quote-unquote microfracture surgery, in which you clean up the cartilage defect and then poke holes into the underlying bone and marrow to release stem cells into the area and regrow the cartilage. Although it's a different type of cartilage that would regrow, it's like filling in a pothole with a lower quality material. The other option essentially involves taking a piece of cartilage from your own body or from a cadaver and planting it into the area of defects. These are very difficult, highly skilled surgeries. In Umtiti's case, an elite professional footballer playing for a club with access to the best surgeons and essentially limitless medical funds who already invested a huge sum into his transfer and future, my guess is that the team was suggesting the latter option, transplanting cartilage. That rationale is reinforced by the fact that if microfracture is done first and fails, the remaining options are not as good as if they'd been done first. Long story short here, there isn't a great answer for cartilage defects, and the post-op recovery is quite extensive. The reality is Umtiti did himself no favors by playing for the knee problem over the summer during the World Cup. That being said, he was pegged to play a key role in a tournament he likely dreamt of his entire life, so I can't blame him, but it was the perfect storm. Once we got to the season, Umtiti continued to opt for conservative therapy rather than biting the bullet on the surgery. Perhaps he thought that sitting out those 5 months would cost him his starting position at Barca, but it looks as if it was another short-sighted choice. By not opting for surgery, his timeline for recovery with this condition became far more questionable, and as a high-level club with huge aspirations, Barca can't sit and wait around. Accordingly, they're currently pursuing Ajax defender Matthias de Ligt, and their summer 2018 transfer from Sevilla, Clement Lenglet, had a good overall season, pushing Umtiti to the rear of the pack. If mutual interest does arise between Umtiti and other teams, for example, Arsenal have consistently been linked to him, they will have to determine the risk-reward they're willing to take on, because this is a condition that will likely have to be managed consistently and proactively throughout his career. It's certainly doable, but obviously it's not what teams are looking for when they're looking to make a big, long-term investment. That's a wrap for this video. You can always find me on Instagram or Twitter at 3CB Performance. My goal is to provide you with in-depth, thoughtful, and evidence-based information, so like, comment, share, and sub to the channel. Thanks for watching, and I appreciate your time. 3CB out.